I carved out the words insane.
I started hearing voices.
I never felt I was one stable person.
Now they're going to
Always
get
shifting
me.
and
He said,
changing.
you're schizophrenic.
I started losing a lot of hope.
And then I was taken to the hospital
I
by
almost
the
wanted
police.
Just trust me. It will
be
take
psychotic again.
Weird, she doesn't work, she's a bum, they drugged me up, told and I was court ordered to take the injection.
I'm participating in this documentary because I, like millions of people, suffered for most of my adult life from symptoms that are called manic depression. And having spent over 20 years in and out of conventional Western psychiatrist's office, being given almost every pill I think that they have in their arsenal, and discovering that none of them really worked, certainly not in the long term. So I went on and off the drugs for years and had episodes and depressions and manic episodes. And finally, after a last spectacular manic episode, had really had enough and did a great deal of homework in trying to find alternate ways to balance out my system naturally rather than throwing synthetic drugs on top of symptoms of an unbalanced system. And it's working. It's been over 2 years. A long, slow process of learning new things just about every 2 weeks or month. Touch wood somewhere. No symptoms, no ups, no downs, which is in my life nothing short of a miracle. Doctors who believe what they're saying you can't get well and you'll never be better, makes it so much worse because you're already in a terrible state. And, and the number, I mean, every shrink I've been to said, oh, you won't get better. The guy at the hospital going, you'll be back, and you'll be having shock treatment next time. And I used to sit there in the bin watching these poor old ladies go down and come back, and I just thought, oh, God,
I know.
Never. And,
Like
and
what,
so
yeah.
they don't say there's hope. They, in fact, eliminate hope.
I think they install fear.
In my second year, I was in residence, and I started getting more and more depressed and suffered a lot from high anxiety. And I started getting paranoid. I thought, every time people I didn't know, students I didn't know were walking by me, I'd hear the snatches of conversation from them saying, oh, isn't he this or that? Demeaning remarks. And of course they were saying nothing of the kind. They were just discussing their own business. I would try to go into class and I would be so terrified that I'd put my back towards the door and back in and sit down in the front row and just put my hands in front of my face. And again, a classic attention grabber, which is exactly what I was trying to avoid. One of the things I did then, which a lot of people who come down with schizophrenia do, is I would walk aimlessly, miles and miles and miles, going nowhere in particular, just preoccupied with my own thoughts.
I started hearing voices. A little bit, just a couple times I heard voices, I thought I was in a room full of people in my living room, and my mom and my brother were there and a bunch of other people, and I thought they were saying bad things about me, like, oh, look at her, she's so-and-so, and so I confronted my mom afterwards and, said, why were you guys saying those things about me? And she said they weren't, so I ended up getting in a fight with my mom and her boyfriend, and then I was taken to the hospital by the police.
I got my compass and my eraser at school, and I carved out the words insane, and I used to color it with my pen and stamp it all over my books, and it was sort of like a premonition about what was to come. So I had a really bad break, and then I got into drugs. I did everything except heroin. I stopped short of taking heroin. I did everything else, a lot of LSD.
Yeah, me too.
Yeah, just like trying to escape from this whole thing that was happening to me.
Bob, you got a wild story.
I had my first episode of depression 30 years ago when I was 17. but I didn't know what it was. I just was in a blue mood all the time. I was irritable. There were angry outbursts for no particular reason. But then there'd be episodes of flaring up of energy, sort of hypomanic sort of states. I was reactive, intense, very intense over nothing obvious, hypersensitive to the slightest criticism, however well intended. I just seemed to ruminate about it and magnify it. And then there would be odd surges of creativity and energy, which could go high or low. So I never felt I was one stable person.
One of the things we have to separate here is the difference between perceptual disorders and mood disorders. So if, for example, you're seeing things and hearing things and you have strange sensations in your body and so on, this is a perceptual problem. That's very different to feeling depressed or feeling elated, which is an emotional or a mood problem. So a lot of people with manic depression actually have perceptual problems, and we think the label is probably wrong.
I thought I was telepathic. I thought everybody in the world had read my mind and that they had a negative impression of me. So when I thought that I had caused people in different provinces to commit suicide because of me blasting them with waves of telepathic neurotic hatred, I thought, well, you know, now they're going to get me. My parents met me at the airport. They saw me from 20 yards away, and I was just, and the first thing they thought was, chemicals, right, hallucinogenics. That's what my sisters thought too, and my brother, that I was taking a lot of LSD every single day because I was in that state every single day.
Our theory, which I think is correct, is that there's an abnormal production of one or more hallucinogens in the body, and we think they are derived from adrenaline. And we're looking upon noradrenochrome and adrenochrome and adrenalutein as potential candidates for this villain that acts on the brain as if they had taken LSD. It's as if I were to give you LSD once a day without you knowing it, you would then become psychotic, but you wouldn't know why. And so we think this is what happens in the body, that their own body produces these hallucinogens, and this is what makes them psychotic.
It all seemed very confusing. I read book after book, and some of the books said that you could add thyroid medication to antidepressants. So I tried that. That didn't seem to do anything. Then another book said you could add lithium. So the psychiatrist said, yes, you can add lithium. So I did that. That stabilized me into a seething melancholy. But at least I was stable. Okay? I was flat. I was flat. One of my clients, who's a therapist, said, you need to go to a psychiatrist and get a proper diagnosis. And he referred me to one, and the chap was very kind, and he actually gave me some psychological tests, and he said, you have dysthymia. And I was so happy because finally I had a name to put to all these problems. But I didn't realize that dysthymia just means chronic depression. So it was an absolutely useless label, okay? But then I'd been told I was depressed, or that I had double depression, or that I had dysthymia. So I had this comforting collection of labels, but not getting any better.
Well, did you ever read the DSM, which is the Diagnostic and Statistical Manual? It's how they diagnose, and there's a list of, I think it's 7 characteristics, and if you have 4 of them or something, I'm getting the numbers wrong, you get the label on the top of the page, and it gets really crazy.
A couple of years ago, a young woman came to my office, and she was really angry. Very intelligent young woman, very angry. And she said she'd become psychotic, and she became fearful. She began to smash up all her furniture. She was afraid she might even do more, so she fled and lived on the streets for 2 weeks. And she found herself in the local psychiatric hospital. And after being there a couple of days, the psychiatrist came along and spent 10 minutes where he said, you don't have schizophrenia. You have borderline personality disorder. We can't treat borderline personality disorder. You're out. So this intelligent young woman read the APA diagnostic manual, She read up thoroughly on the borderline personality disorder, and she read about schizophrenia, and she said to me, I am schizophrenic, I am not borderline disorder.
What is that state that seems to have so many names?
Basically, it's a disorder of brain metabolism. It can be caused by an enormous variety of problems. To develop a schizophrenic picture, we do have what we call schizoaffective, where you can't make up your mind, is it manic depressive or is it schizophrenia? So we call it schizoaffective. We're not sure.
Have you ever heard of Dr. Bradford Weeks, who was speaking at this conference 2 weeks ago on orthomolecular
Yeah.
nutrition?
He's
And
a
he was
young
wonderful.
psychiatrist.
He was
Yeah.
talking about learning to see your thoughts as temporary things that aren't you, as opposed to saying, I'm paranoid. You go, I'm having a paranoid thought. Now, the nature of thought is that it changes, so I'll just watch it and wait till it goes away.
One of the things I like to do is ask them, what do they think is going on? And they'll, of course, say, I don't know. And I'll say, well, what do you think is going on? They'll say, well, you're the doctor. And I'll say, well, what do you think is going on? And they'll say, well, and they'll actually describe very clearly what their situation is. But the whole medical system and psychiatric system is not designed to really listen to the patients, not designed to listen with the patients. It's really designed to diagnose, treat, and unfortunately, this whole issue of stigma is just to get them out of sight.
Ian and his best friend Chris were talking about their past hospitalizations and their psychotic breakdowns and schizophrenia. And of course, for all my years in Montreal that I lived there, my father was an old-fashioned guy. Now, she's fine. Oh, she's a bit weird. She doesn't work. She's a bum. Oh, quiet. Shh. She's just a bit strange. And so I was sitting in this pub and I say, Ian, please, there's people. The waitresses are going to hear us, and what are people going to think? And But then I started meeting everybody seems to have schizophrenia.
When I was hospitalized, I saw a psychiatrist who was on top of all the latest research. He said, yes, it's the psychosis, it's biochemical. It was caused by non-specific stresses, emotional trauma. And basically what he was hinting at was that it was my parents' fault. My parents, thought about it for a couple of months and they decided no way.
It's exquisitely painful for a mother or a father to accept that they have a mentally defective child. Mm-hmm. They may want to help, but they don't understand. And they have a whole lot of fear.
Fear, yeah.
And what do?
I think a lot of parents just feel their child is bad. He's being really bad.
On purpose.
On
purpose. Yeah. Can I just say something about parents? I mean, I've spoken to a lot of parents who have gone the traditional route with their children because they're intimidated. And I think it takes a lot of courage to actually take a child. It was courage for me to actually look for another method because I was given such flack by the traditional medical profession.
No psychiatrist, no reputable psychiatrist in 1998 would say schizophrenia or manic depression or severe clinical depression is not biochemical. They're not doing enough to tell each and every parent who walks through their doors, hey, it's not your fault, it's not your kid's fault, it's not society's fault. When the bed came free, my parents talked to me, and for some reason I was in a quiet mood and I agreed to go. And then the radio was on and I heard Barbara from As It Happens saying, what a docile little boy, what an immature little baby. He's agreeing to be shoved into hospital against his will.
I think when you're incarcerated against your will, which is not a pleasant thing to be, a lot of the people don't want the drugs down their throat, but you, of course, have to have them. They find legal ways to make sure you take them. So when I was talking about being in a state of delusion and how real that is, and that perhaps the worst approach is the approach used in American hospitals, which is, I'm paraphrasing here, basically, you've got to know you're crazy, and you are crazy, and we're going to feed you these drugs until you do and not let you out until you realize you're crazy. Well, if you're in a paranoid delusional state, that's about the worst thing you can say. So I said something like one must have compassion for the delusion and acknowledge that the patient thinks it's real. Of course. Well, about 3 psychiatrists came up afterwards and went, that's an interesting idea. And I thought, my God, what are they taught in school?
The traditional treatment is drugs. And here I'm talking primarily about a class of drugs called tranquilizers, and they have been changing with time. They started out with simple phenothiazines, and now they are much more complicated. We also use, the classical treatment also includes antidepressants. In a small number of cases, it may include anticonvulsants, but primarily it's drug-oriented therapy. And these drugs are very helpful. I certainly would have difficulty practicing without them. But in my experience, going back now until 1955, schizophrenic patients on drugs alone don't get well. It's very rare. Even the strongest proponent of drug therapy will maintain that less than 10% of their people ever go back to work. It's a very expensive disease that destroys humanity, destroys people. It's a kind of living death because it strikes so early. It'll strike a young man who is 25 at the prime of his life, and he's finished. That is, if he is only given drugs.
The drugs were worked. They worked, but they also made me very lethargic, very tired. The side effects were uncountable. I felt horrible. I couldn't see straight. My eyes were blurry. I had artist dyskinesia, which was shaking.
I started losing a lot of hope. You know, I thought, well, the only way I can ever feel different than having this dragged out blah feeling is to have the hallucinations come back. You know, I almost wanted to be psychotic again.
I was so angry, I got on the phone to the drug company, and a very kind pharmacologist whose job it was to field these calls, he listened to me. I was just hot. I was hostile. And I poured out all the adverse effects. I was having trouble sleeping, I was just angry and agitated, I was anxious, I was just dripping with sweat. There was a whole list of effects. And he said very calmly, "Yes, we know our drug does that." I said, "Well, what do you mean, your drug makes sick people worse?" He says, "Now hold on here. It doesn't make all sick people worse. And I'm sorry to hear you're one of these ones where it's not really helping you. Please go back to your doctor. He'll reduce the dose." But of course, on the lower dose, the depression broke through.
We have miracle medicines. They work extremely well in certain situations. So we use them in everything because we think that everything is going to be just as miraculous. And what we're seeing now is the damaging effects of those drugs. There are 106,000 in one estimate from a study, 106,000 deaths every year from the side effects of drugs. That's more than twice as many from car accidents in the United States. So prescription drugs kill more people than car accidents. It's amazing. And that's when they're used correctly.
But then I'd go back and say, "Well, I'm having this problem, that problem." He'd say, "Don't worry, you'll get better. We'll double your dose." So I thought, well, he's a healthcare professional. He had many degrees and diplomas on his wall. I'll trust him. So we'd double the dose. Well, of course, I'd get worse and worse. He kept doubling the dose. So finally, I figured I was going to lose everything. My home, my family, my business. But I kept reading. The doctor said, "Don't read. Don't learn about your illness. Just trust me. Take the pills." But I figured, screw it. I'm going to read.
I think there's frustration among patients, but there's also frustration among doctors. Doctors also don't know what to do for some of these things, and sometimes, unfortunately, they design their treatments out of frustration rather than knowledge. It's like, well, I gave him that because there's nothing else to do, or I gave her that treatment because there's nothing else to do. You see that with chemotherapy for cancer. They give a treatment because there's nothing else. They don't know what else to do. In fact, I have a lot of other things that I could offer them, nutrition and vitamins and alternative treatments to the conventional medicine. But sometimes even I don't have anything, and I don't want to give people treatment that may be dangerous just because I don't know what to do.
How do you get patients, all of you, off the medications, particularly the benzodiazepines, which I gather actually grow new neural receptors if you've had them for any length of time?
It's very, very hard. Very difficult.
You have to be very vigorous with therapy if you can get them off with high doses, I think, that help of vitamin C, niacin, vitamin B6, magnesium in particular, and other things that help anxiety. If they can get out and exercise, it really relieves a lot. So I think that's putting a combination program together is more important than any one thing that you consider like a magic bullet.
Many of the psychiatrists I addressed at that convention thing in Nebraska who didn't expect what I was going to say, and I've learned so much more now than I would have had, were coming up and asking me questions which sort of shocked me, like, how did you find out that Depakote tries to mimic the effects of GABA and cerebrospinal fluid? And I had to go, it's written on the package.
I would read one page and I kept reading the same page over and over and nothing would sink in. And so at that point I thought, well, I'm just unmotivated. I'm just a lazy, there's something wrong with me. I should go for a run and then maybe I could memorize my page better. And then I just started getting more and more depressed. So I started taking wake-up pills because I thought, well, I don't have any energy, so I need some caffeine. So I started taking 4 wake-up pills a day, and each wake-up pill is equal to 35 cups of coffee. Woo! And I still couldn't get up. I guess the caffeine finally hit me because after I graduated, I ran out into the field and I was running all over the place. A week later, I was in the hospital and they drugged me up totally. So I was flat out for, I have no recollection of the time.
With nutritional deficiency and a real blood sugar problem, it's very, very easy to go into mental illness. So what we tend to see is people are malnourished, they start using stimulants. Because they use stimulants, they can't sleep at night, so they start having alcohol. Because they have alcohol, they get depressed. Because they're depressed, they get put on some medication to bring them up. Because of that, they get more anxious. Because of that, something to bring them down. And before long, you got a mental health problem, you're diagnosed with schizophrenia.
If you were to come to me with the symptoms of schizophrenia, or the symptoms of bipolar psychosis, or anxiety, it doesn't matter what it is. First question I have is, why? Do you have food allergies? Food allergies. So they are really cerebral allergies who are masquerading as if they were schizophrenic or manic depressed. Allergies, B3 dependency, B3 deficiency, pyridoxine dependency, zinc deficiency, excess copper. There are a whole variety of things that will mimic what we see as the final syndromes.
And I noticed this when he was in hospital long before I became a nutritionalist. And I'd say, hey, his stomach is all upset here. He's having digestive problems and he's got sore throats all the time. And there's something going on here. It seems to be connected with his mental state.
I've seen a large number of schizophrenic patients who were cured when they stopped drinking milk. Most people don't look upon milk as a hallucinogen. But if you are allergic to it, in many people you get a kind of a brain allergy, which makes you psychotic. So food allergies are a major part of it. Milk, wheat, eggs, things like that.
I stopped talking to people for days. I was on kind of a high. I felt totally euphoric, and I thought people were crying tears of joy every time they saw me because I was... And the things I imagined they were saying about me was, look at him, he's 21 and he's got the maturity of 70 years of age. Tears of joy running down their faces.
So when someone's having these hallucinations and hearing voices, which most people will, send them crazy in the sense that you get pretty paranoid if that's happening. What's actually happening is the normal chemicals in their brain, we call them the neurotransmitters, they're kind of the communication molecules. Adrenaline is one, dopamine is another. They get processed wrongly, and actually they break down into substances that are hallucinogens.
Well, I've had people come to me, for example, with panic attacks. And panic attacks, you think, oh my God, they're going to have to be on medication or heavy-duty psychotherapy. In fact, on occasion, I've diagnosed them as hypoglycemic. And once they went on an appropriate hypoglycemia diet and kept their blood sugar more balanced, and some other supplements such as chromium, vanadium, magnesium, manganese, and vitamin C, and so on, once they began to balance themselves biochemically, this so-called psychological problem, the panic attacks, seemed to go away.
All of our function of our brain and everything depends on a stable level of glucose in the blood. And the conventional view used to be that you're either fine or you have diabetes. But now we know there's a big gray area in the middle where someone has a blood sugar problem. And of course, if your blood sugar shoots too high, you can become very manic. And if it shoots too low, you can become very depressed. So very often mood swings are connected with an inability to keep blood sugar levels even.
Listen, I just heard a lecture at the last orthomolecular conference on fats, which I never would have listened to before, and I was sitting with my girlfriend, and it was clear we were the only two sort of perennial patients in the room. It was mostly doctors. And at one point, as this fellow was talking about oils and the symptoms, the mental symptoms you can get without the essential oils,
Essential fatty acids.
my girlfriend Rosie went, "Essential oils? Of course, they're essential."
If you're deprived of either one of the two essential fatty acids, your behavior changes because your brain doesn't work, because your brain is made out of food, and if the foods you require for the structure of the brain aren't there, it doesn't make sense that you would expect the brain to function normally. There are studies that show that schizophrenics hallucinate less when they get the essential fatty acids they require. There are studies that show that your intelligence goes up and you learn faster. Learning disabilities, clumsiness, or what's called dyspraxia, respond well to essential fatty acids. And they have to get from foods two substances the body can't make.
And 70% of our brain is made directly out of fat. And the big problem these days is that we're eating the wrong kind of fat. We eat a lot of saturated fat from milk products or from meat. And also a lot of the fats we eat have been damaged or processed. You see, if you look on a lot of products, you see these hydrogenated vegetable oils, and they're really bad news. What we're lacking are essential fats, and they come from seeds and nuts and also from fish, particularly the fish with teeth.
There's kind of a framework in which these episodes happen. I was tending to be variable, volatile, vulnerable to deep, dark, long depressions for no reason. But then there'd be episodes of flaring up of energy, sort of hypomanic sort of states.
This is what we call high histamine. What histamine does is it speeds up the body's metabolism. It like turns up the fire. And they tend to be compulsive and obsessive in their personality. They wake up early. Their mind is always thinking. And this is not a problem. There's an awful lot of very successful people and creative people and multimillionaires and so on who are high histamine. They're kind of driven people. However, the high histamine people tend to become deficient in nutrients because they burn up the nutrients faster. So if they're on a bad diet, that sort of mild compulsive obsessive tendency can really flip over into mental illness. And there's a downside of this type of personality, which is they go into a state of suicidal depression.
Have you done hair analysis and toxic minerals?
Yes, I have.
You had low zinc, high copper,
Yeah.
which
I
is
got
very.
high copper, yeah.
Yeah,
Those
well, that's
two
in the
I had high zinc and copper.
smoking. Believe me, smoking is will increase
And
the
uranium.
uranium.
Yeah. And
Plutonium?
Dr. Hoffer last night said that's from the mountains I live near Montana.
There's quite a few heavy metals or toxic metals that affect brain function. Lead used to be the most concerning, but now probably we're looking more at copper. See, copper, unlike lead, is essential for the body. You need a small amount, about 1 or 2 milligrams. But some people get much too much copper. And I'll give you a lovely example.
And what does copper do? The same as lead?
Well, copper makes you very anxious. So we need a certain amount of zinc and a certain amount of copper. And if you're zinc deficient and you're getting too much copper, this can actually flip you over the edge as well.
A mental health center where I was consulting, we had a young lady who had been in the hospital for 3 months and was on sufficient psychotropic medication that she could not attend high school. And she was one of those people who had white spots in her fingernails and painful knee joints, things like that. So I just started her on zinc and B6, and over a couple of weeks she was able to get off her medications and was doing quite well. But as we've learned over the years, of course, no one really believes that anything can be that simple.
We have a very good concept of nutrients, vitamins, minerals, essential fats, and so on. But what's really changed in our modern life is our intake of anti-nutrients, substances that may be toxic to the body. Well, it could be anything from pollution, in terms of car exhaust. It could be pesticides, which create a problem for some people. It could be food chemicals. We have 3,500 permitted man-made chemicals now in our food supply. And we consume on average 16 pounds a year.
Half of the stuff that when I started to go that made me even crazier was being frightened of being crazy. And that stress.
The way of understanding stress is it's the body's way of going into fifth gear. It's an emergency mode. And it's something we're not meant to be in all the time. And you can know this because one of the major effects of adrenaline is to shut down digestion, shut down repair, and channel everything towards energy. And if you run out of nutrients and you have this excess adrenaline, you may start making substances like adrenochrome, which can make you even more, crazy.
That's exactly what happens. Anything that will increase the secretion of adrenaline, which includes stress, it includes reactions to foods. In fact, one of the body's ways of dealing with a violent allergic reaction is to dump a lot of adrenaline to the body. If you go to the emergency because you're having a severe reaction, they shoot you with adrenaline. And if you have the potential to become schizophrenic, that is, you have the potential to make adrenochrome in excess quantities, then it will increase under these effects of this kind of stress. So allergies will do it, stress will do it. Severe unremitting stress can be very, very harmful to a patient with schizophrenia.
A doctor who my parents had met said, I know another doctor and her son had these kind of problems, and apparently the solution was quite simple. He was treated nutritionally. I started taking the niacinamide and the vitamin C in mega doses, 3 grams a day each. And within a month, I was starting to be like my old self. And within 2 months, I was quite a lot better. And I'd started taking the vitamins before actually seeing Dr. Hoffer. And when I saw him, he said the improvement would continue, and it did.
Orthomolecular is very simple, although it sounds complex. It just means correcting the molecular balance in the body. We're all made up of molecules. If we're made up of the correct ones, if we eat the correct ones or take in the correct ones, we have a much better chance of being healthy or recovering from illness than if we take in the wrong ones. So orthomolecular medicine is basically the use of natural substances that occur in the body, and that includes diet, and it includes supplements to the diet. It might include vitamins, minerals, amino acids, fatty acids, the essential nutrients that we have.
6 months after taking the vitamins, I was reading the newspaper saying, what can I do? There was a job offer to teach skiing, and I had been on the racing team at university. I phoned them up and I told them my background. They hired me and I taught skiing that winter, and I wasn't on any medication whatsoever, just the megavitamin therapy of Dr. Carl Pfeiffer.
Anyway, I went and walked into Dr. Hoffer, and he gave me the HOD test, the Hoffer-Osman diagnostic test. He said, you're schizophrenic. And it just floored me. I thought, what? Oh, there's a name for it, And he said, yeah, and I want to put you on the B3, B6, zinc, and vitamin C megadoses. So I did that, and off sugar, and the whole nutrition thing.
It's hard to cut out, isn't it?
Yeah, the sugar was hard. But for 3 months I was religious. I didn't even eat ketchup. If anything had sugar in it, I didn't touch it. And I still thought, well, I still don't feel any better. And he said, so I went back in to see Dr. Hoffer after about 3 months, and he said, well, why don't you take the HOD test again and just see? So I took it, and there was a 30-point difference.
Wow.
I had actually improved, but I wasn't feeling like I was. So then later on, another 3 months went by, and then I got really sick. I think it was all the toxins coming out. And I went into hospital for 3 months. And he upped my meds. I had some shock treatments, and that seemed to do the trick.
Great, and are you staying on the medication?
I'm on low meds. I've stayed on all. I've added vitamins of my own over the years.
Right.
So the combination treatment is the best, because with the combination treatment, once you have used the drug to help them improve, you maintain that improvement by the use of vitamins, so you can now withdraw the drug, get rid of the drugs entirely, or take such a small amount that there are no side effects, and now they're able to function perfectly well.
And when I tried to get them at the hospital to give Darren the treatments that he suggested, B3 and C and all those things, and of course at the hospital they said, oh no, that's toxic. Those vitamins are toxic.
As if the pills aren't.
Yeah, right.
Yeah. The pills are really good for you. Don't take those vitamins.
My mom brought the vitamins to the hospital, and they actually blackmailed me not to take my medication. So they would say, you don't get any more help if you don't take your medication.
That's probably the best thing that happened.
Well, it was the best thing that happened for the opposite, for the flip reverse, because then what happened was I found out about vitamins, and 3 weeks after taking B3 at a high dosage, the B3 being schizophrenic, started to clear my side effects, my symptoms, and they lowered the medication.
With any treatment, including orthomolecular treatment, one has to take into account the potential side effects. And there are two types of side effects. There are the major or life-threatening side effects, and there are the minor inconveniences. For example, with niacin, there's a flush. When they first start taking it, they start flushing, which is hot, and they're red and itchy. And if they don't know what's going to happen, they get frightened. It's a minor inconvenience. It's not a major threat.
And by this point, I'd read about 150 books, and something was starting to sink in. And the books from Europe actually said that depression is being treated using ginkgo and other things like St. John's wort, and they work. And the beauty of why they work, they have minimal adverse effects.
St. John's wort became very popular, and I had been using it already in my practice, and I really wanted to share the experience that I had had with it, because it's so important for the medical profession to know that there is a very, very good substitute for the antidepressants. You know, the synthetic antidepressants work okay, but they have really bad side effects. Really bad, starting headache, insomnia, anxiety, sexual dysfunction. I mean, who wants those side effects? And the research has shown that when you take St. John's wort, you can have all the effects, the positive effects of an antidepressant, and you don't have these terrible side effects.
So I gradually pieced together, from reading a lot of the papers from the Journal of Orthomolecular Medicine, which vitamins, minerals, and amino acids work as teams and help the brain restore normal function. And then, of course, I read a lot of things about diet, so I didn't expect that would be a factor at all. But I started to change my diet. I cut out sugar, I cut out white flour, and I would say at the moment I'm 95% of normal, all through doing things that conventional doctors seem to scoff and laugh at.
Do you have patients who have gotten better from what would be a classical Western diagnosis of, say, whether it be schizophrenia or manic depression, where conventionalism says the patient cannot get better?
Oh, certainly, yeah.
Yeah.
And I'm just one of the newcomers, relatively speaking, over the last 10 years in this, you know. Hoffer's files are tremendous.
Mm-hmm.
I remember a patient of mine who first came to me having been delusional, had hallucinations when she was in high school. She had been an honor student, and all of a sudden her life was shattered. And I saw her 9 years later. She'd been through every drug in the book. She had been through alcoholism, street drugs, trying to find something for herself, and nothing seemed to work for her. And finally she came to me, and I put her on a program of diet and vitamins, and it was absolutely astonishing to me because I had a little skepticism myself back in those days. And within 3 to 6 weeks, she started to feel a little bit better, just a little bit, just beginning. And then within a few months, she was almost completely better. And she had been ill for 9 years.
When I deal with people with mood disorders and schizophrenia, I try and make a measure of what's happening with them. And then I investigate them exceedingly thoroughly, because I find that the vast majority of people do have biochemical problems, which we can define, correct, and then they get better, which is really rather nice. That doesn't mean I don't use the standard medications. Of course I do. They're useful, but I don't pretend that they are the be-all and end-all that we're supposed to believe. No, that's just a sort of little crutch while orthomolecular treatment is starting to work.
If you had a house plant and it was kind of fading green, you would think, is there too much light? Is there too little water? You would look to see if there's toxicities involved or deficiencies. And we all know that. And so why do we lead with an expensive pharmaceutical agent when we wouldn't do that with our plant? We check to see the water and check to see what the light is. So it's not really discovering orthomolecular work, it's really remembering that that's what we should be doing all along.
You know, the statement is, if you eat a well-balanced diet, you get all the vitamins and minerals you need. And any intelligent person asks, well, what is a well-balanced diet? And the answer is, it's a diet that gives you all the vitamins, minerals you need, right? So you kind of spin out of this cycle thinking, well, I probably eat a well-balanced diet. And that is a myth.
There's not a whole lot you need to know. There's only about 50 essential nutrients. All you want to do is put together a program that gives you optimum quantities, and you have to guess at them because they're somewhat different for people, of all 50. And you have to start taking those so you're getting at least the basic material, and then see how many problems disappear. And then you maybe need to spend more time on certain people, like Dr. Hoffer talks about, the ones that require much higher doses for some reason, that are dependent on certain nutrients, or that need to be detoxified. So the approach is not that complicated.
The unexpected effects with nutrients are generally benefits. So I talk about side benefits. So when you give nutrient, vitamin B complex, for example, for a mood disorder, which it may help in many cases. Sometimes it's just a simple deficiency. If you do that, you're going to find that you lower their homocysteine levels in the blood. That's a metabolite that is associated with heart disease. So giving B vitamins for one purpose has a side benefit, is it lowers heart disease.
So I can tell my patients, if they ask me, and I say to them, why don't you ask me how dangerous this is? They say, okay, how dangerous is it? And I'll say, well, you're going to live longer. Is that going to be a problem for you? Most people don't find that a problem.
I think cure, in terms of any illness, is not really the right term. I think the propensity will always be there. But when we treat appropriately, when we restore the balance, then you have a healing. But cure means that the propensity may be gone, and I don't think so. If we have a propensity, it'll stay there. And that it would be a false, it would be an illusion to tell people you're cured, that's it. Because in fact, they do have to maintain a certain diet and certain supplements in order to maintain that balance.
I was interviewed once or twice for a television program or for a newspaper, and I remember one time watching myself on the tube. They had spliced out the part where I talked about vitamins.
Yeah.
Wow.
Oh, really? I went to 3 different doctors. Right. Can you give me a referral to see Dr. Hoffer? Oh, you don't want to go see him. You can join my group therapy session, or you can, no, that guy's a quack, or all those vitamins, that's just a bunch of crap, and you don't want to believe that.
Many of my colleagues have been at great risk, and many have lost their licenses for practicing what I think is absolutely appropriate medicine, and far more appropriate than what's called conventional medicine.
So anyway, I got this registered letter that said within 10 days they no longer wanted me to prescribe vitamins, minerals, or make dietary adjustments in my hospitalized patients. And I called around, like Carl Pfeiffer and several others. I had, I think, 11 people lined up to come in and testify on my behalf if something was going to happen at the hospital. Then I called an attorney whose daughter had, he was a very prominent attorney in Kansas, whose daughter had had an acute schizophrenic break and did very well, and to this day is doing very well. Anyway, I called him and asked if he would help, and he said, oh, sure. I think his direct quote was, I've always wanted to sue those bastards. And he wrote a letter, the punchline of which was, the last paragraph was, that if the committee wanted to go to court and to maintain the standard of care in Wichita, Kansas, was to shock, sedate, and sedate, we would be happy to do so. And restrain, I think, was, yeah, shock, sedate, and restrain, I think, was the refrain. And then suddenly, within a week or so, it was fine for me to prescribe vitamins, minerals, and make dietary adjustments.
One doctor at an interview I gave the other day, a lecture I gave, had a question from the audience afterwards. He said, what if a patient comes to me and wants to try a nutritional therapy, and I don't know much about it except that it doesn't work, and I just want to know what advice I should give them. And I said, more important than the advice you give the patient is to listen to yourself. You're asking a question, I don't know much about it except that it doesn't work. Well, if you don't know about it, how is it you have an opinion on it?
Doctors are inherently very conservative. They're also very reluctant to overstep the bounds of what their teachers in medical school want them to believe. And there is a climate of fear and brainwashing that does occur. Fortunately, that's all breaking down. And slowly and steadily, the tide is turning in the direction. And slowly and steadily, they are finding themselves dragged, kicking and screaming and whining and sniveling into making concessions to orthomolecular ideas here and there.
The pharmaceutical companies control medicine, not in the sense that there's a plot. I don't think there's a plot. In the sense that they are selling a product, they're going to advertise their product. So the average doctor reads only about drugs. That's all they're taught. They take classes in pharmacology to teach them about drugs. They don't take any classes in nutrition. They don't take any classes on the therapeutic advantage of vitamins.
The party line for instance, major cancer organizations was that anyone who suggested nutrition had anything to do with cancer was a quack. Then a few years later, of course, that was changed, and of course we delight in seeing the ads for eating fruits and vegetables and things like that that have come along. But back then, I think we were considered mostly quackery. And then when that change came about that said maybe nutrients are good for preventing cancer, we became half quackery. And now I think we're about quarter quackery.
I mean, there was a wonderful example, which is one of 200 stories of similar things, of Dr. Kilmer McCulley. And he was the doctor who did research on what is now known to be one of the most significant risk factors for cardiovascular disease. That's homocysteine.
Mm-hmm.
It's a toxin the body produces from protein. And if you have a large amount of this toxin, you have a high risk. And by the way, the cure, how you prevent having this factor, is B6, folic acid, and B12. So it's the same kind of thing. Lack of nutrients leads to problems, in this case with cardiovascular disease. And he was effectively kind of given the boot out of a very prestigious medical college, and had years of struggling to actually get anywhere within the medical establishment because of his insistence to continue this work. Now he's a star.
I've known many families who went totally broke. They've mortgaged their homes, lost everything they had in order to try to get help for their sons and daughters. And eventually they have to become public charges. They go to some of the old inadequate hospitals. And many of them wind up in the streets. The new mental hospital today are the streets.
Mental health problems is the most rapidly growing. And as we go into the year 2000, there's no question that is going to be the real focus on medicine. And if we have a way that works and is less expensive and can get people off the streets and out of mental institutions, then it will come in. It's just a question of time.
But you're not alone, and you can get better, contrary to what your psychiatrist may have told you. You can get better and stay better.
It's not really discovering orthomolecular work, it's really remembering that that's what we should be doing all along.
The unexpected effects with nutrients are generally benefits.
You're going to live longer. Is that going to be a problem for you?
Once they began to balance themselves biochemically, this so-called psychological problem seemed to go away.
Within a month, I was starting to be like my old self.
6 months after taking the vitamins, I taught skiing that winter.
And then within a few months, she was almost completely better.
Well, I've added vitamins of my own over the years.
I would say at the moment at 95% of normal.
The solution was quite simple. He was treated nutritionally.
And now they're able to function perfectly well.